Among 98 million people living in the Philippines, a population remains hidden. 40,000 children, like Divine, who are blind or visually impaired.
Walk by me across the lonely roads that I may face.
The reality of the situation is that less than 5% of children with visual impairment in the Philippines have access to school.
I was jealous of my cousins who were going to school. I also wanted to go to school.
I wasn't able to find a local school that could provide assistance to a child with low vision.
Schools lacked trained teachers, braille materials, and other resources.
We are prioritizing providing tactile materials.
LCIF joined with partners to help the Philippines successfully integrate children like Ethel with visual impairments.
Working with LCIF and Perkins International helped us to train teachers in public school.
That's letter G.
Therefore, provided opportunity for children with visual impairment to be in their local community and be schooled.
12-year-old Syra is the youngest of 3 blind siblings, but the first to go to school.
The children are still hidden away at home. Parents are not aware that their child with a visual impairment even has the right to go to school.
Raising awareness and empowering parents is an important part of the effort.
I find out many children not coming to school at the age of 11 and 12. Sometimes you can see parents hopeless. I encourage the parent that the child can learn, can go to school.
The world does not end with my daughter being blind. They need education, they need rehabilitation, they need to work. I'm very happy that Lions broadened into this venture. Finally, blind children receive quality education.
How about this one? What letter?
K.
Very good. As I teach them how to write and how to read using the braille, I see a lot of changes.
See? I'm really happy that the Lions Club donated braille printing equipment. It's really very important for our children to have these books.
LCIF also provided low vision training.
Most of the Filipinos don't know the difference between totally blind and low vision.
I found out that Ethel had a visual impairment when she was 4 years old. She was given glasses, but they didn't work at all.
That's why clinical assessment is very important. We give optical devices like spectacles, magnifiers, telescopes for when the students want to look at the blackboard.
Building capacity, increasing awareness, and equipping communities to serve well into the future is what Sight First does best.
Lions brings their vast experience and networks in the eye care and medical fields, which we can now link with the educational field to really reach far more children and families.
Because of the trained teachers, the students are enrolled in the regular school. Along with their sighted peers, they feel that they belong.
Once the people in the community see that the children are learning and participating in the community, then they're far more willing to involve and include the children.
Increasing the number of schools equipped to serve children with visual impairments from 178 to nearly 350 is only the beginning.
Ethel would like to go to college and help her family.
They have possibilities to have a quality life because they are now in school.
I think Helen Keller said it best when she said, alone we can do so little. Together we can do so much.